I want to take a little break from the clinical talk and talk to you about dilemmas and how to resolve dilemmas. So I've been DMing back and forth, talking with a lot of PT students, PTAs, an athletic trainer, that are all in this dilemma. They're at some point in their career, either still a student or a new grad or a couple of years of experience, but they're all in the same spot. So this goes to prove that this isn't a student problem. Okay, so all of you students that think that this is unique to you, no, this is the same problem that you're going to have 5, 10, 15 years into your career. It's the same problem. So as soon as you figure out how to address the problem and solve the problem with things that you have at your fingertips, we're not reinventing the wheel here. These are things that you could actually do right now to solve your problem right now so you don't have this problem 5 to 10 years later, okay? So I'm going to talk about the student that has the dilemma because they think they're the only ones that are in this position. I've got news for you. You're going to have this problem for a long time unless you do something about it now. Okay, so students that I've been talking to on discovery calls or DMs, especially following the 3-day challenge, saying, hey, I love your stuff, really want to do it. I see that, when I get out into the real world, it's not what I want to be doing. I've already gone on a rotation, hated it. I've already seen, what people are doing and what I'm going to be expected to do, and that's not what I signed up for. Okay, love your stuff, hate the other option, but I'm a student, I can't afford to do it. Okay, so one of these students, actually a couple of these students were in this position. They are personal trainers, so they're already working out with people at the local gym or CrossFit gym, maybe they're CrossFit certified, whatever it is. They're already working with people as a personal trainer, and probably like a typical personal trainer, they're probably not making much. Okay, so how could you increase what you're asking to increase your income and increase the quality of people that you're working with and start to apply the things that you should be learning in school, but you're not going to learn in school? Wouldn't that be cool if you could increase your income, if you could have a really good income while you're still a student, so you're not broke, and that income is working with people that you are really interested in working with instead of being a personal trainer, making a couple bucks here or there, helping somebody lose 15 pounds for their 30-year high school reunion? Nobody wants to do that. So what if you could increase your skill set to increase how much you charge people and also get to work with the people that you want to work with, all by doing one thing, and then when you graduate from PT school, you already know how to be a clinician because you've already figured out you're not going to learn how to be a clinician while you're in PT school. So a lot of you think, well, once I get out of PT school, I'll start making a lot of money and then I can pay to get in this course and then I'll learn how to be a quality clinician. Because remember, I just told you that I've been talking to people with 5 to 10 years experience that can't afford to get into the shift either. Why? Because they fell for the PT school, lull you to sleep, think that you can't do anything while you're in PT school, get out into the real world thinking you're going to have all this time and all this money because you're not going to be in school. Well, guess what? Your job is going to take more time than PT school, and your job is going to pay you less than you think it's going to, and you're going to have the exact same problem 10 to 15 years from now. So what I told this person is, why don't you get in the shift now? In 4 months, you'll have a skill set that you can charge more money. So the remainder of the 2 years that you have left, or 1.5 years, whatever it is in PT school, you can actually have an income. And you can battle the crap that they're trying to put in your head with what you're going to learn in the shift. So day one, when you walk across that stage after graduation, you already know how to be a quality clinician. And you already have business experience from running your own thing, doing your own side hustle while you're in PT school. So now you have the confidence to walk out of graduation and do whatever you want to do because you have the confidence, you have the skill set, you have the thought process. You've already got yourself out of the broken medical model. You're not waiting to do that after you graduate. It's already done. So that's how you solve your problem. Your problem isn't that you don't have money, that you're a broke college student. The problem is you're not looking around you to see what you can do now to fix the situation that you're in. There's always ways around the obstacles that are in front of you. The successful people see obstacles and say, here's how I can use that obstacle to my advantage. So the way you use the obstacle of being a student to your advantage is, you know, you're not spending 40 hours a week in school. And hopefully you're not spending 40 hours a week studying. You could be spending the time that you're not in school going through the shift 1 hour a week, then applying that with patients and clients that want to pay you good money. And now you've just figured out, so now you've made school actually something that's helping you because it's giving you time that you're not there, that you could do something else with and make money rather than just sit there and accumulate debt. Okay, so there's situation number one. Situation number two, we've got a PTA who has been working in the broken medical model for 2 to 3 years. They hate it. They don't like what they're doing. They're already starting to apply 180 thought processes. They're getting better results than they were when they were doing the old school protocols and symptom modification crap. So they already know they're getting results just by getting rid of the stuff that they were doing before. They really haven't even replaced it with anything else. They just got rid of crap. So took stuff out of their toolbox. Now the question is, what do they put back in their toolbox to get even better results? So here's my advice to them. Same thing. So they think they're going to save money and get in the shift in 2 years or 4 years. You're not going to save money. If you haven't saved money up till now, you're not going to save money in 2 to 4 years either. They're not going to give you a raise other than 3% per year or whatever they're giving you. So how do you think you're going to save money over the next 2 years to afford to do something in 2 to 4 years that's even going to be more expensive then? The shift now is cheaper than it's going to be in 2 to 4 years. Okay? So you already know you're not going to save that money. You know that you could pay for the shift spread out over 5 months. You could get rid of Netflix, stop buying Lululemon, stop going to Starbucks, stop drinking beer and going out with your friends on the weekends. Take that time and do things that are free or work on things that are going to make you more money later on. So in 4 months, you could reinvent your skill set. And PTAs tell me this all the time. They go through the shift, they go back to the clinic. People are getting off the PT schedule so they can get on the PTA schedule because the PTA is better than the PT. You can do that in 4 months. Then what happens? Then you have all these people saying, I want to be on your schedule. Then what you can say is, you know what? I have a following here. I bet if I just left and opened my own small little clinic with very little equipment, because all I need is my thought process and my skill set, I could open up my own clinic and probably work 20 to 30 hours a week and make a lot more money and be way, way happier doing my own thing. So you could do that in 4 months, pay for the shift, increase your income, increase your quality of life in 4 months, or you can pretend that you're going to save money for the next 2 to 4 years, which you're not. Your career is going to continue to go down. You're not going to get the pay raise that's going to keep you up with the inflation of cost of living, and you're never going to get in the shift, and you're never going to realize what you could have done. Okay. Now, scenario 3, we've got the PT with years of, or the athletic trainer with years of experience. It's the same thing as the other two. Waiting is not going to fix your situation. Cut the things that aren't must-haves. Get into the thing that is a must-have that will actually increase your income, increase your satisfaction in 4 months, and you solved all your problems. And now you're doing what you want to do. Okay? So there's always ways to work around the hurdles. There's always ways to take the obstacle and say, okay, this is what seems to be a negative right now. How can I turn that negative into a positive? Start looking around, and I bet you'll figure out things that you can do. The problem is we've been taught as society to sit back and wait, sit back and save, and while we're doing that, the rest of society is running past us and crushing us. Stop sitting around waiting and thinking that something is going to fall in your lap. It's not. You're going to have to be uncomfortable. If you bought the shift, are you going to be strapped for a while? Yep. That's called discomfort. You know what comes out of discomfort? Success. You know what happens when people never have discomfort? They never go anywhere. They fall into mediocrity. And when their life is near the end, they figure out, wow, I really blew it. I never took a chance on doing what I really wanted to do. Okay? Look around you, figure out where you have ways to do what you want to do, who can help you get there in less than 4 months. Okay, so that's what discovery calls are for. So when you guys get opportunities to get on the phone with me and tell me, this is my situation, this is where I want to go, my job is to say, okay, if I were in your shoes, this is what I would do. Okay, so take advantage of the things that are around you so you can help yourself now rather than waiting for something to happen down the line, which hasn't happened yet. And students, stop thinking that you're going to have money and time when you graduate and get into the real world. You're going to be in the same situation that you're in now, if not even worse. Okay? Let me know if you need help.